My paper is titled Healthcare Inaccessibilities Challenged Through Podcasts. My name is Samantha Lee, and I am an undergraduate student at the University of California, Los Angeles, better known as UCLA. This paper does a critical analysis of the various types of healthcare inaccessibilities faced by the Latinx community. The subsections of healthcare disparities include the language and cultural barrier, geographic inaccessibility of a medical facility, and the cost of healthcare. Podcasts are a novel form of news media production that disseminates vital information. 75% of Americans are familiar with podcasting, which is over 144 million Americans. There are also millions of listeners around the world getting their information in the form of a podcast. This paper centers around Salud America in particular, a health-oriented podcast geared towards getting information to Latinx community members who are seeking care and to listeners who have the power to advocate change. I would like to give a little background on the Latinx community. The word Latinx is a gender-neutral term for those of Latin American descent. There is a prominent lack of healthcare professionals of Latin American descent. Only 5.8% of physicians are identified as Latinx. This is an extreme minority as white doctors make over 50% of all healthcare professionals. The percentage of registered Latinx nurses is even smaller, coming to a percentage of 2. This is especially crucial due to many Latinx community members lacking proficiency in the English language. 60% of Latinx individuals say they have had a hard time communicating with a healthcare provider due to the language barrier. This causes discomfort in seeking medical attention if they are not able to communicate. The Latinx community also has a strong religious and traditional belief system. For example, 72% of the Latinx community has never used prescription drugs. This is especially prominent in those with indigenous backgrounds who have a history of using natural medicine. The Latinx community also has a history of not speaking about culturally taboo subjects, such as sexual health and mental illness. Lack of this cultural knowledge could lead medical professionals to provide treatments or ask questions that make the individual uncomfortable and therefore will not return to receive treatment. Dr. Hughes, a guest speaker on a Salud American podcast episode, detailed that the healthcare system should move from a more one-size-fits-all approach to a more individualized plan. This is crucial with communities like the Latinx community that have strong religious and cultural traditions that would prevent providing equal treatment, as many of the uniform treatment plans would not be accepted by that community. The next subsection is the geographic accessibility, or lack thereof, of medical facilities. Due to a large majority of Latinx individuals living in border towns, many of which are in rural areas, results in having the nearest hospitals for certain services being hundreds of miles away. For many Latinx members who live paycheck to paycheck, traveling hundreds of miles away for medical treatment is not possible because they cannot afford to take time off of work. Healthcare professionals are more likely to work in urban areas as opposed to rural areas due to better salaries. Many professions, such as farming, in rural areas already are exposed at a higher risk to pesticides, which, compounded with a geographic inaccessibility of medical services, puts the Latinx community at a higher risk of more prolonged and severe comorbidities. This pandemic has further exacerbated the healthcare disparities the Latinx community faces. Several podcasts have denoted the lack of resources and staff in major cities, concluding that rural hospitals, who already have scarce resources, are further crippled by this pandemic. Under the Trump administration, the public charge rule was established, which states that if an immigrant uses federal programs, such as medical care, it could jeopardize their green card application. Many members of the Latinx community feel trepidation of getting COVID-19 related medical assistance due to the fear of their family being denied a green card. However, the public charge rule clarified that it does not apply to COVID-19 related hospitalization services. However, this information is not well disseminated. But podcasts like Salute America offer new ways to get this life-saving information out to hundreds of millions of people. This brings me to the final subsection of the healthcare inequalities faced by the Latinx community. One podcast episode from Salute America details how there is a disproportionate increase in the Latinx mortality rates by cancer because they don't have the same access to resources. Occupational health insurance is the primary way that individuals can receive affordable health care. However, many jobs available to undocumented immigrants who lack proficiency in English are unable to provide health insurance as a benefit of employment. This leads the probability of being a Latinx uninsured individual to be significantly higher than the probability of a white individual being uninsured. To try and combat this disparity, thousands of free clinics have been established all around the United States. However, recently, the Senate did not renew federal funding for these free clinics, cutting the spending by 70%. Due to the already scarce resources due to this pandemic, these clinics are having a difficult time providing apt medical services. Many podcasts have called on listeners to enact change by contacting their representatives and encouraging them to renew federal funding. These podcasts also encourage listeners who need medical treatment to seek out nonprofit organizations and cost-reduced resources in order to get the medical help they need. Under the Obama administration, the Patient Protection and Affordable Care Act allowed 20 million adults to gain medical insurance coverage. However, approximately 25% of Latinx individuals in the United States are undocumented, making them ineligible for government medical services. In addition, approximately 5.5 million American-born children of undocumented parents have avoided signing up for Obamacare out of fear of exposing their parents' status. However, Obamacare specified that their status would not be transferred to the immigration services, but once again, this information is not well known. Podcasts, again, such as Salute America, have proactively disseminated this information to try and mitigate the healthcare disparity in America. I would like to close on the impact of artivism through podcasting. Technology is a staple commodity in our society, and millions of people are turning towards technology to access information. Podcasts are becoming global modes of communication that allow disparities in health equality to be challenged. Salute America's mission is to serve the Latinx community via dissemination of information. This is achieved by offering their podcast episodes free of cost and offering written versions of their audio podcasts to those who would prefer to read rather than listen. Through the inspiration of new media production like podcasting, these healthcare disparities being faced by the Latinx community can be mitigated to achieve a more equitable and accessible healthcare system. These are the citations of the graphics, and the other citations for the quotes are in the bibliography of my paper. Thank you.